Okay. Hello, everyone. A very good evening. So, you are all here from various batches of FSTN courses. So, okay. Thank you. Your thumbs up and hand raises shows that you are all are interactive and present here for this very important class. And today's class is all about diet counseling and patient care. Yes, you all have raised your hand. I think you all have queries. Let me start this session first. Then we will answer your all of your queries. Okay, I will be there. Okay, I'm lowering your hands. Okay, so it will be easy for me to not able to hear. Why not able to hear? Uh, okay, so kindly respond. Kindly unmute yourself and respond that am I audible or visible clearly or not? Yes, some of you are saying that I am audible. Must be.
Yes,
Yes,
ma'am.
I'm audible.
Okay. Thank you so much.
How are you, Didi?
Yes, thank you so much. Okay. So, yes. Okay. So, where I was about that the today's class topic. So, today's class topic is diet counseling and patient care. And who I am the dietitian, and I from first very few years ago I started my journey as a consultant dietitian, and I was working for more than 5 years as a community nutritionist also. So I have that experience and knowledge in the field of clinical nutrition as well as the public health nutrition. Okay, so I am here today to guide you that as you have joined already in various courses in FSTN, and you all know you are here to learn about the nutrition and dietetics from very basic. Okay, so what is the nutrient is and how they actually composed in different type of food items, and how those food items nourishes us, and those food items sometimes play as a therapeutic diet, and those therapeutic diets are actually play a role of a medicine. That is how we cure by those food item intake. And now we are relating those theoretical knowledge into the practical implementation processes. And in the professional training classes, I think you all have trained and you all have that idea how to handle a patient, how to do any different disease case study, and how to consult those patients. But what about the total process? It means you have learned everything. You have learned the numericals 1 to 0, you have learned the multiplications, additions, subtractions, divisions, everything. But when you have to do all together at a time, then what you have to do? So I am here to guide you that in this process, which steps you must follow, which are the most important basics of diet counseling, what is the basic difference between diet counseling and all other processes like these. So we will discuss about that today. Okay, so let me share my presentation so that we can discuss more and more about this topic. So till then, if you have any query regarding this class, before starting this class I want to answer your question. So do you have any regarding this class? So I think I have discussed with you all enough that what is the class about. Except this, do you have any query regarding this class? Who were raising your hands, now you can answer me, or if you have any questions. Okay, so you don't have any questions. Now I am starting today's presentation. Okay, thank you so much for your answer. Okay, so we are going to know that what is the diet counseling is. So the diet counseling is a collaborative process where a registered dietitian provides individualized advice to patients to promote the health and manage diseases. So now here is the term you can raise your question that ma'am, we are not the registered dietitian. I am not also. Okay. So is it ethical to do diet counseling or to provide any kind of therapeutic diet charts? Now I am answering that question. That before joining in this course, you must have a basic idea the difference between nutritionist, dietitian, and health coach. These three terms are very relevant nowadays, right? So in these three terms, we are actually covering the today's whole session. Okay. So the nutritionist are those person who have that knowledge of nutrition. It means who have completed their degrees or diplomas or any certifications in the subject of nutrition and dietetics. So they should be called as a nutritionist. Okay. And the health coach are those person who don't need to do their academics in the field of nutrition and dietetics. It's not mandatory that they must completed their academics in the field of nutrition and dietetics. Anyone can be health coach. Okay. Just like our mother can provide us most nourished food item whenever we fall sick, we have any medical emergencies or any problems. Our mothers are the first dietitian in our home, right? So in this process, our mothers can be without any academics, without any degrees. They actually a health coach who have knowledge of nutrition by training, by experience, or any other way. They have that knowledge to implement, and that maybe provide you the good result also. So those person known as a health coach. Now I am talking about the dietitians. Who are the dietitians? Dietitians are those who have completed their academics in the field of nutrition and dietetics, and they completed the clinical diet therapeutic diet they can prescribe the therapeutic diet as they actually completed their internships or any professional training under any hospitals or any doctors, minimum 600 to 1000 bed hospitals or any clinics. Okay. So those persons are actually called as dietitian. It means they have trained in the field of medical centers, and they actually face those clinical critical care patients, and they completed their trainings in these fields. So those person who have actually in these three differentiation, we can sum it up in one line that all dietitians are nutritionist and health coach, but all nutritionist and health coach are not dietitians, as they haven't completed their clinical practices in the clinical setup, right? Like hospitals, most hospitals are actually count in this sector, and any doctors under medical setup. Okay. So here is the basic term. Now we are discussing about that registered dietitian, dietary modifications, dietary counseling, and dietary assessment can do anyone. Okay. But when we are talking about diet charts, and if there is any modifications with the calculations or the quality of diet, like low sodium, high potassium, high magnesium, these kind of modifications with any clinical patients, then we must go for the dietitian. As we are here from various courses of FSTN diploma programs. So I think if you haven't done any nutrition and dietetics degrees or other courses, you do not right to say yourself as a dietitian, but you are a certified nutritionist. So in this designation, what you can do, you can do all of the things as a dietitian can. So in the practical implementation, what is the difference between dietitian and nutritionist? The we dietitians are playing actually the role of nutritionist most of the time. When the patients goes into the critical condition, then we become dietitian. Otherwise we have to maintain our role as a nutritionist, because most of the time we have to assess our patients, we have to counsel our patients, we have to modifying our patients diet chart according to their lifestyles, and their lifestyle modification guidance we have to provide. So these four things we need to do all the time. So these things are the main role of a main role of a nutritionist or a dietitian. So while we are doing these four roles, then actually we are managing all of the lifestyle activities. By managing these lifestyle activities, we can promote the health, and we can manage all of the diseases and disorders. There's those are actually relevant in nowadays. Okay, so I think I have cleared this basic point in the starting of this session, that what is the diet counseling is. Okay, now I am discussing about importance is very very relevant in this era, because if we are not counsel our patients properly, then what will happen, the patient will not connect that what is the problem is they are facing, and what is the right solution just for them, not for all everyone's solution they are actually asking for us from us. So in this time they need their personalized guidance from us. So here is the basic difference between counseling and nutrition education. So I am going forward to that slide. Okay, so that you can understand better that what is the basic difference between the nutrition education and the diet counseling. Okay, so here is that slide, that where we are going to understand that what is the nutrition education is and what is the diet counseling. So first of all, we have to know that nutrition education builds the foundation of knowledge. So
Ma'am,
when I play the,
ma'am,
yes,
ma'am,
yes,
can you please show the previous slide?
yes, showing. Do you want to take that screenshot? For that purpose, I will
No,
take
ma'am.
it.
Actually, I am
We will
writing down
provide you the
the.
PPT.
Actually, I am writing down.
Okay, okay,
So, actually,
okay. Here is the first slide.
I just wrote the point actually.
Okay, okay, okay.
The
Taking class
introduction
notes.
to
Okay, okay.
diet counseling.
Okay. So take a
Thank you,
screenshot
ma'am.
and write whatever you want to write as a class note. Now I am going to the next slide, that is the nutrition education versus diet counseling. So the diet counseling is that ensures personalized application and adherence. So when we are going to the term nutrition education, it means that we can do it for community as well as the individual person. But diet counseling, it is actually for the individual person, because with diabetes or with any kind of metabolic disorder, the same disease can be happen to the all of that community. For say in a room I have gathered 15 to 20 people who have diabetes, but those person are not same. They are similar, they have similar disease, but they are not same. Their metabolic response, their body's condition, their food intake, their choices, their complications are must be different. So that is why diet counseling actually refers to that a person with the individualized diet consultation. Okay, so the goal of nutrition education is to increase the general nutrition knowledge and promote healthy eating habits. Generally we do in the national nutrition month, or we do this kind of activity in any camps, right? any community nutrition program, we do this kind of activities as a nutrition education awareness. Okay, but diet counseling is actually the activities that we do with one is to one interaction. Okay, so in these one is to one interaction, we do this kind of activity in our own chambers or any personalized diet consultation session. Okay, diet counseling is to address specific health concerns, modify dietary behavior for therapeutic outcomes. So these are the basic need, basic goal of the diet counseling. Now you can differ that what is the basic difference between two of them. Okay, the approach of nutrition education is population or group based. It means I have already gave you example that workshops, public health campaigns, we have done these kind of activities. And diet counseling is the individualized patient centered approach.
ভাত
Shimoy,
দাও খাবো তাই।
Shimoy, kindly mute yourself.
হ্যাঁ, আরে দুপুরে এসে দেখি ভাত একটুখানি ছিল,
Shimoy, kindly
তারপরে
mute
ভাত
yourself.
খেয়েছি।
Okay, thank you, Shimoy. Okay, yes, we will provide, I will provide you the presentation slide to every group so that you can read this slide properly and you can build your foundation in the field of nutrition and dietetics. Yes. Okay, so the content of the nutrition education is general dietary recommendation, balanced diet, food groups, and preventive nutrition. And when I was not was, I am also right now when we do the community nutrition counseling processes, as the name of nutrition education, we actually guide the community how to cook, how to rightly cook the food items so that their nutrition content can be intact. So in this way, and if we go for any special populations like pregnant women, lactating women, geriatric person, or any a kind of cancer patient, so for those we generally do provide their common nutrition guideline for those particular population also. So depending upon the population's category, we can provide in general dietary educations, the nutrition education, so that they can relate themselves and they can implement those knowledges in their practical life. Okay, and professional involvement you have already learned by my guidance. And now I'm moving forward to the next slide showing that what are the main principles of nutrition and patient care. So here as we are here for the diet counseling guidance, for that I will actually guiding you, I will actually guide you about what in which stage we have to start our consultation process, and where we should end, and how we should end this consultation process. Okay, so first of all, when a patient will come to you, when a patient will in front of you and they need any diet consultation from you, so when the patient is all about seeking solutions from you, then you must be very attentive to that patient. Okay, first of all. Second of all, when patient is interacting with you, you must be maintain a eye to eye contact, so that the patient must feel comfortable to share their problems, their complications to you most freely. And in this way you can consult that patients most deeply. Okay, so these are the basic interaction process, you can start with this. Okay, after that you have to be polite and very you have to be a good listener as well, so that you can ask this type of questions like what happened, for which particular problem you want solutions from me, and how you feel that diet can solve these type of problems. In this way you can actually engage that patients to take appropriate consultations and your guidance from your side. When you will counsel that patient, it is not sure that that patient will attentively listen you. For that purpose, your engagement with the patient must be established when they are actually telling you the problem. Okay, so in this way you can build a rapport with that patient. Okay, so the rapport building is very important to give a powerful consultation to that patient and do more effective counseling to that patient. Okay, and when you have build that rapport, when you have taken the superficial data of that patient, now you are as a dietitian or nutritionist have to start your role as a professional. So how you start your role? You have to start your role with the assessment. Okay, so after completion of assessment, you have to connect those data with the solution. So here the solution of this nutrition and patient care is enlisted. Like you have to provide whatever the disease is according to their disease condition, according to their physical need or the physiological need. You have to maintain a balanced diet. Okay, so balanced in the sense how their body needs, you have to connect that with those solutions. So you have to provide balanced diet so that they can meet their nutritional adequacy, and those adequate balanced those nutrient adequate balanced diet must be individualized. Otherwise the patient will not accept. In India, the value of a diet chart is very variable, different in different region. Okay, so to implement the right dietary modifications in any patient's life, you have to make individualized diet chart. Okay, and in this way you can actually do any impact in a patient's life. Okay, and that is why you must have that evidence based practice, experience and right knowledge. Okay, so by these weapons you can provide a right diet chart. Okay, now I am moving forward to the next slide. In next slide I have discussed that steps in diet counseling process. So the what are the steps? I have already told you that after building that rapport, after listening patients problems, you have to start your role as you have to assess that patient. And how you should assess that patient? Assessment is actually consist of four steps. You all know ABCD: anthropometric. A for anthropometric assessment, B for biochemical assessment, C for clinical assessment, and D for dietary assessment. If you have done these four assessment process, then you have already taken all of the data that you need to prepare a good diet chart. Okay, so gathering all of these data will help you to know that patients more minute. Okay, so after assessment process you have to determine that what is the right diagnosis of this patient. So in your diet chart there will be three layers. Okay, so in first you have to write that what is the patient's complaint. After patient complaint you have to write the diagnosis, and you have to then you have to start that with the medical nutrition therapy or any nutritional advice that you are providing. So that will comes after that. So patient's complaint is not diagnosis, patient complaint is different, clinical findings is different, and diagnosis is different. So diagnosis is the kind of uh, conclusion you can say. After listening all of the complications, after assessing all of the medical data and clinical findings, then you can conclude that total medical problems as a name of diagnosis. Who are here as a medical professionals, you all know which is the diagnosis known as. So it must be clear in your diet chart as well. Okay, So after writing that diagnosis, you have to move forward according to that, as you are a medical professional. A dietitian or a health coach or a nutritionist always a medical health the professional. So when you are in medical field, you have to maintain the right rules, because after providing this diet chart is a note of a dietitians, that is a medical tools of any other medical professionals. Okay, so you have to maintain this kind of rules also. Okay, so after diagnosis, you have to determine the interventions as well. So what are the interventions? Developing implementing a nutrition care plan tailored to the patient's need, and including dietary modifications, educations, and lifestyle changes. So by these interventions, you can monitor that patient's progress, and you can evaluate that how this diet chart is effective to that patients or not. I am discussing about last three stages in later slides, that will be easier for you to understand. Okay, now I am moving forward to the next slide, that you have to know again that what is the counseling process is. And here in this counseling process, we can divide this counseling process in 5 phases, and these 5 phases are known as 5 A's. Okay, so in 5 A's, first we have to do the assessment. You all know what is the assessment. Okay, so assessment is the gather informations on dietary habits, medical history, lifestyle, readiness to change, and barriers. And purpose in diet counseling, you all know that here is the main funda is actually deposited. So next is advice. After assessment, your advice will start, and after your advice, it must, as I have told you, it must be individualized. So after your individualized dietary recommendations or any nutritional advice, that must be accepted by the patient, otherwise all are in vain. Okay, so that must be accepted by the patient. So that must be agreed by the patient, collaboratively set achievable realistic nutritional goals will be the most effective, otherwise there is no value. Okay, in this way the patient will own that diet chart, and the adherence to that plan will be most effective. Okay, and next is very important, after giving the diet chart, the dietitian's role will not end. You have to mind that also, because here is the most effective role. You have to start actually as a role of a dietitian, start after providing the diet chart, not while you are providing. During providing the diet chart, our role is very minimal. After providing the diet chart, our role is the most effective, and our greatest role actually provide comes out the good result from that. Okay, so after providing the diet chart, the assist, it means how you identify the obstacles to implement those diet chart in the patient's life. So is it resourceful for that patient or not? The strategies that you have guided to your patient with your dietary counseling, is it ready to is it ready to implement it for that patient or not? These will actually you have to notify while you are doing follow up after providing the diet chart. Okay, so to support behavioral change through problem solving and skill development, so these are the main role you can play as a dietitian or a nutritionist. So after that, the arrange is the very important part that I have already mentioned. Plan follow-ups, monitoring, ongoing support, in person or online. Nowadays we generally do the follow-ups in online by showing by taking the every meals picture, the thali picture of every meals. We need to assess that how they are taking their food items, as I have discussed to that as I have um, recommended to that patient, just like that they are taking that food item or not, we have to assess that as well. Okay, by assessing their every days every meals item, we can take an idea that is it tolerable for, is it easy to acceptable for that patient or not. Okay, when a patient is nodding their head, yes madam, yes sir, I can apply that diet chart, this is not enough. Okay, when they are actually implementing their diet chart in their life, this is the actual assessment you can do. Okay, so here is the main role of arrange, the follow up planning is the very important role they can play. Okay, it will ensure the sustainability and accountability of dietary changes. Now I am moving forward to the next slide. Next slide will show that how nutritional assessment techniques are actually performed. And as you are already in this course, you have that idea that how nutritional assessment techniques are done. And now I just brush it up your memory that how we should do. When a patient will come to us, we must, I have already told you, we must build a eye to eye contact and build a comfortable rapport so that they can share their problems, and in this way you can learn the patient's problem most clarified way. Okay, after that you have to take the anthropometric data, that is their height and weight measurement. After height and weight measurement, depending upon the patient's age and the lifestyle stages, you have to take other anthropometric data. Like if a patient is pediatric, then you must have to take the MUSC data. If a patient is a quite obese patient, then waist hip ratio is very important data for that assessment. Okay, so according to that we have to take other anthropometric data. Okay, and with the height and weight we can calculate BMI as well. Okay, and nowadays we all have some sort of weight machine, so that when weight machine is connected to your phone with the app, so you can get the data of body composition as well. Otherwise, who have the body composition analysis machine, who get an idea that how is the body composition of that particular patient is, and according to that fat mass, muscle mass, subcutaneous layer, according to this kind of data, you can provide a right diet chart for that particular individual. Otherwise the diet chart will be superficial level. If you have idea of this kind of anthropometric data, then your diet chart will be more individualized for that patient, and then you can assess as well their patient's BMR also. Because when you have a clear idea of a patient's metabolic rate, then your diet chart will be more practical. Okay, so that is why we need actually 1:1 diet consultation, and that is actually most effective also. Otherwise the diet chart can't be, every dietary modifications will give you result, but how this is implemented and how this is appropriate for that individual, there is the actually difference lies on. Okay, the biochemical data you all need, after before any consultation we all need biochemical data. Otherwise we can't provide, again we can't provide right diet chart for that individual. Okay, and when you are interacting with the patient, when you are doing physical consultation, the clinical assessment will be easier for a dietitian or a nutritionist. But otherwise when we are online consultation, it is actually quite difficult to analyze a patient through any device. For that purpose the right question to assess that patient's clinical data is very important. If you are quite experienced, or you have that technique to ask right questions to get data as we need as a clinical assessment, we can provide a good diet chart for that particular patients also. Okay, and the dietary modifications, that is mandatory, otherwise you can't connect their patient's existing habit to the habit they must build to get that result. Okay, so the dietary assessment, we generally do the 24-hour recall method, but I will say the 7 days dietary recall is the most effective. In this way you can get an idea on an average how they intake the food item. Okay, so average dietary intake of 7 days is the most effective dietary assessment, we can say. Okay, now I am moving forward to the next slide. Okay, therapeutic diets overview. Okay, so before going into the therapeutic diets, I want to ask you, as a dietitian or nutritionist, do you have any idea that what are the basic things we have to solve? Now you can ask me that, ma'am, if a patient come to us with diabetes, and we actually as a nutritionist need to manage their lifestyle and their habits so that they can manage their blood sugar level, so that the diabetes can hamper their lifestyle, and they as we know, this diabetes is a silent killer, and the diabetes never can reach that silent killer role if we manage in the very initial level. Okay, so in these stages, what is the main purpose to know all other complications? Why we need to know all of the metabolic rate, to the hormonal secretions, to the sleep pattern, to the stool pattern? Why we need this kind of information? If you ask this question, I will tell you, you can write it down as well, because this is a very very mandatory data I am telling right now. That is, when you are consulting a patient, you are not there to solve that particular disease actually, because every physical complication is related to another physical complications. Okay, everything. Okay, if you say, ma'am, if a patient has eczema, that is a skin problem, how this is connected to the patient's diabetes condition, I will connect later that. Okay, but now I am guiding you that how you must actually do dietary modifications, what will be the very important steps you have to do, whatever the disease the patient have. If you are not correcting the patient's malnourishment status, your diet chart will be incomplete, your diet counseling will be incomplete. So when a patient comes to you, you have to assess that if that patient is malnourished or not. Why we do the weight checkup, why we take the patient's current body weight, why we take, to assess that is this person is in right body weight condition or not. If it is high, then we have to provide the diet chart that can lower that body weight condition, and the patient can reach the ideal body weight condition. Okay, uh, it is actually applicable for any normal person, not for the athlete have some weight goal, athlete or model person have a different body weight goal. Those are the exceptional categories. Other than these, generally we must have a goal to maintain a body weight that is ideal for that person. Okay, so the weight management signifies the patient is in right nourishment condition or not. And after that, you have to assess their internal nutrient content, like iron content, vitamin D content, vitamin B12 content. Is it right, is it in right level in or not? We have to assess that as well. Okay, otherwise your diet chart will be incomplete, because if you are not correcting the patient's malnourishment status, no other disease will solve permanently. Your diet chart can play a medicinal role if you correct this kind of complications as well. If not, your diet chart is incomplete and your treatment is also incomplete, and your result will not reach that expected level that must be. Okay, so the weight status, malnourishment status, and third, that is very very important, their digestive status. Because that the total session is all about the food item. Okay, so when you are providing the food item that is appropriate for condition, and it is not digestible, or it is not actually okay for their gastrointestinal system, then all are in vain. Okay, so the digestive status assessment is very very important. For say, you are providing apple for a patient who have diabetes. Okay, for right multivitamins or multimineral source, you are providing apple, and apple is very very problematic for a IBS patient. Okay, so apple is generally signifies as a FODMAP diet. FODMAP is a category where the fermentable oligodisaccharides and polysaccharides are included, and in these category, apple is considered. Okay, so for that purpose, apple is not digestible or not okay for their gastrointestinal system. So how that apple will affect their patient's body? Okay, so digestive status assessment is very important. When a patient is in any kind of clinical complication, you have to assess these three data. Okay, otherwise your diet chart will not be right appropriate for that patient. Okay, I have told you repeatedly this purpose of these three type of assessment, and while you are correcting this problem, then your diet chart can play a very very powerful role to beat any kind of clinical complications. Okay, now I'm entering in this slide that therapeutic diets overview. So in this therapeutic diet overview, you have actually some examples that high protein diet, low sodium diet, diabetic diet, low fat diet. Other than these, there are lots of nutrient management diet, like high carbohydrate diet, low carbohydrate, and for different disease there are different management in your courses, in different modules on that. Okay, I am not here to learn all of these therapeutic diets. You have learned theoretically, but the practical implementation is here, that I have told you these three assessment you must do before any diet chart writing. Okay, and fourth but no actually last but not the least, that is metabolic status assessment. How the patient's metabolic status is. If a patient's body is actually very what can I say, in those if any individual's body is most intent to heat it. Okay, whatever food you are providing, those are actually generate a lots of heat in a person's body. So it means their body needs some cooling category food items, so that their body's temperature can maintain properly. Okay, so it means their metabolic rates are are affected by some kind of food item, or their body's internal status is this. Okay, so in this way you can assess the patient's normal tendencies to be anxious or stressed. If a person is more normal tendencies to be anxious or stressed, it means their body status always be in higher level. So the body temperature will always be in higher level to generate that kind of heat. As you all know, that stress hormone or the anxiety hormones are actually BMR raising hormone. They can generate heat inside our body. Okay, so metabolic health, or we can say their body's food digesting quality. If you understand, if you assess this kind of things, then the right guidance of food intake will be uh, given to that patient. Okay, so the metabolic status assessment is last but not the least very important assessment you have to do for any kind of diet consultation. Okay, so nowadays whatever the lifestyle disorders are, generally most of the disorders are categorized as a metabolic syndrome. So in this metabolic syndrome, if we solve these four datas, and if we individualize these kind of complications solution to that particular patients, then the diet chart will be more effective for that patient. Okay, now I am moving forward to the next slide, that is patient education and behavioral strategies. So now we have to understand that motivational interviewing, goal setting, adherence to the strategies, and long term success. So these four terms I have already told to you in various way, but in this slide we have to jot down these steps, because these are the very mandatory steps. I'm repeating that after providing the diet chart, our main role is starting. So if you are not motivate your patient to explore or resolve the problem and their dietary habit, that will not actually implementable. So you have to continuously motivate your patient so that their dietary habits can be intact, and their lifestyle must be run in a good way. Okay, so the goal setting, so that that their adherence to that dietary recommendations that you have provided to that patient, that must improve their lifestyle habits and their nutritional status as well. Okay, so that will lead you to the long term success, and that is the actual reward for us as a dietitian or a nutritionist. If we see our patients are getting relieved from their complications, and our recommended diet charts are improving patients life to get rid of that complications, those are the actual reward for us. And this is the more than consultation fees actually. Okay, so here is the main strategy. If you follow properly, then you can get that reward perfectly. Okay, now I am moving forward to the next slide. Next slide shows that we dietitian can't play role the effective role in a patient's life alone. We can't do that. We have to do that good teamwork. Okay, so all of other nutritional implementations are the good nutritional implementation. We need other medical professionals as well, like doctors, nurses, psychologists. If somewhere any immobile patients, so if we need physiotherapist, we have to work with all of them in hand. Okay, so these are the very important thing. If any of you thought that I alone can do the good changes in a patient's life, you can't. Okay, and another term that I have forgot to written here, that is family member. Okay, so the cooperation of the family member, though they are not the medical professionals, but though they are not when you are consulting your patients, though they are not connecting you, but they are actually connected to the patient. So if there is no cooperations of the patient's family member, the outcomes will not reach at that point that that must be they actually reflect. Okay, so the family members cooperations also very important to reach that particular outcome. Okay, so here is the most important role that a multidisciplinary team can show in the patient care. Okay, now I'm moving forward to the next slide, that is challenges in diet counseling practice. So in every diet counseling practice, we have seen that these are the main challenges we face, that patient non-compliance, so addressing barriers to the adherence and providing ongoing support. So common obstacles like these we have encountered in patient consultation. Cultural food practices, so adapting any dietary recommendations to respect cultural and cultural food preferences are mostly implementable, because otherwise in no diet chart will be rightly implemented in any patient's life. Okay, so cultural food practice provide is very important. And that is very last but not the least, that is very important, that is socioeconomic barriers. So addressing food insecurity and access to the healthy foods according to their socioeconomic condition, you have to consider that condition as well. For that purpose, from very ancient time, we generally guide our patients to intake locally available, seasonally available, low cost dietary modifications. Okay, we provide this kind of food that is actually acceptable for any kind of socioeconomic status. When the season of mango is there, so mango will be the right nutritional food item to provide them the good vitamins and minerals and carotenes and all in the mango season. When now as the amla, the oranges season is there, so then you have to provide this kind of food item. Other than this, if you provide the very costly food item who are low socioeconomic groups, so that will not be acceptable for that patient. So the locally available, seasonally available, low cost foods are highly recommended for any kind of socioeconomic status, either it higher or lower, any kind of, irrespective of any socioeconomic status, you have to provide these three kind of food item, and that are actually easily acceptable for us. Also, body can't listen our socioeconomic status, but our seasonal fruit are those connections that we can build with the food to our body's relation management. Okay, now I am moving forward to the next slide, that is future trends in diet counseling. So future trends are shows as a personalized nutrition that we are actually working in this field. Other than these, the nutrigenomics, telenutrition, digital health applications, nowadays various apps are there, various softwares are there to calculate the food items nutritional content, or to assess that packaged food, not some sort of packaged food item, is it good for them or not. AI nutrition can solve that issues. So these are the digital health applications nowadays everyone is applying. Okay, so as a dietitians, if you are aware those kind of trends and you are knowledgeable and experienced enough, then you can build a bridge in between them, that right implementation and right knowledge. Okay, so we are here in middle of these two item. Okay, if we do the right thing for our patient, so these modern things actually do benefit us. Okay, now I'm moving forward to the next slide, that here are the reference, and thank you everyone so for being so attentive in this class. Now I am open to everyone to answer your questions. If you have any questions, feel free to ask. Okay,
Ma'am, please show the previous slide. No, the
okay,
previous one.
okay, wait.
Ma'am, what is telenutrition or telenutrition? I means
Providing nutrition
the knowledge
counseling
we
using
get from YouTube,
technology.
like that.
No, YouTube like that.
Okay, counseling.
Yes, it is a nutritional
Okay,
counseling that
nutritional
we can
counseling
provide
over
through
phone.
technology. Yes.
Okay.
Okay,
Yeah,
Shimay,
ma'am, I
what you are
understood.
telling, I can't understand as I was talking about that.
Sorry, ma'am.
What you are asking, that I was not listening as I was answering your question. So you can repeat your question.
Ma'am, I just asked about tele nutrition.
Okay. So I have answered that question. Okay. Any other questions if you have? So before answering any questions, I want to
Ma'am,
know
what
that
was the point next to the tele nutrition? Actually, I am writing down all of the points.
okay, wait. I'm telling.